Hello everyone, I am Dr.Ilan CEO of Rela Hospitals, Chennai. I have more than 20 years of clinical experience in healthcare industry, worked in the UK and also in India. I have my friend Mr. Bharani, who is a data science specialist and also artificial intelligence specialist. Hi Bharani, how are you?
I'm very well. Thank you so much, Dr. Ilan.
Thank you for coming in, Bharani. Actually, it's good to have you here. I just wanted to ask you some questions about AI and how it's going to impact in healthcare.
Absolutely.
Good. We met in Indian School of Business in Hyderabad 4.5 years ago. Am I right?
Absolutely.
That time, if you look into that period, I don't think we have spoken much about AI.
True.
I think this concept of AI, and then we are seeing a lot of application coming in AI impacting day-to-day life. We are seeing only for the last 1 or 2 years. Why is there a sudden change in the technological landscape? What's the reason behind it?
So, there were days when people were talking about AI, but getting access to the data and storing the data was extremely costly back then. And as in how we progressed, the cost of storing the data reduced significantly. That is one prime reason why AI applications are most widely seen nowadays. Because to build an AI application, you need data. And data cannot be costly. And that is the prime reason why AI applications are being built extensively. Right. So that's the prime.
So there's no software development per se. It's all about the data storage. That has made a big difference in the way it's progressing. Am I right?
Yeah, absolutely. Because math equations and machine learning algorithms were there since long. But the actual usage of that is coming to light thanks to data. So, and also one key thing is IoT sensors. Right? People are trying to understand what are the key business problems. For example, if you take one of the OECD nation, Japan, 1/4 of its population is greater than 65 years age. So what's happening is there is a huge problem with respect to the nursing and treating these elderly patients. So there is a need basically to come up with robotic machines, etc., which needs AI, and then people are putting a lot of sensors on the patients as well. For example, on their body to check their intestinal movements, when should they go to a laboratory, etc. And then the nurses with those robots will come and lift the patient. It will assist them to take the patient to the laboratory. So this is a perfect combination of a business need being addressed through robotics, which needs AI, and perfect application of sensors, which is generating data. So there are sensors which are generating data. There are AI applications built on top of that, thanks to the business problems which are being identified by the people now. Earlier, there were problems, but people weren't thinking that, okay, we can have sensors, we can have data, and thanks to the data, we can automate things using AI. People weren't thinking in that way. Now,
so we know that most of the research in healthcare is happening in the US. And if you look at the US healthcare development, this EMR and all these things have been there more than a decade now, 10, 15 years ago. In India, I think we are in the early stage. Getting patient data, we have blood test report and all this stuff, but if you look at the clinical parameters, we don't have much of data. Even big corporates don't have much of data. We are not collecting those at all. How do you think this AI applications can help in Indian population?
Yeah, absolutely, Dr. Ilan. So, as we have discussed, data is critical. It's like garbage in, garbage out. If the underlying data is not of good quality, or if we are not capturing enough data, we cannot do much. Though we might end up building AI applications, but it would become useless for business. Doctors, hospitals might feel that, AI applications are not helping. It's not AI applications which are not helping, the underlying data is not helping AI. Right? So I would say that the first emphasis should be on capturing the right kind of data. Today, for example, when a doctor and patient have conversations, the entire information is put on a prescription form. And next time when the patient visits, this previous history is gone because it's not nowhere recorded. It's just recorded on a piece of paper. Instead, if we can have some kind of a Bluetooth technology wherein patient and doctor have conversation, and if that conversation goes and sits in a database, like name of the patient, age, what kind of symptoms this patient has, and what kind of medicines doctors are prescribing. If it can be digitized, the next time the patient comes, we will have the data available and we can do some analysis on what is the frequency at which this patient is falling sick. Is the patient falling sick only during specific seasons or during the climate change? If we can fix this, then AI applications will flourish given the kind of population we have. We are the largest population. So I think AI in healthcare especially will be a revolution.
I feel AI is going to have a big impact, like many industry, even car driving will become very easier. I'm sure this will have a huge impact in the healthcare, especially for the doctors in terms of predicting disease and then precision medicine. I think these are the areas I am expecting this to make a major impact. But I have a question for you actually. Say AI diagnose a disease. Say there is an X-ray. AI says this is a diagnosis. In case if the diagnosis is wrong, who is responsible?
Yeah.
The company who has made the AI or the doctor who has treated the patient based on the diagnosis made by the AI? Who is responsible? What's an ethical issue we have to face? And can you quote some example from other industry of how it's being handled right now?
Sure, absolutely. Yeah. So there is an exercise which was carried out by MIT, and the example was as follows. Suppose there is a track, okay, and the train is coming at a higher speed, and you have kids playing there. It is prohibited to play there, but the kids are playing, 6 years old, six kids, and there is another space where an elderly person is walking. He is okay to walk there, and the train should not take that route. Now, which way would you go? Would you actually take the wrong direction, wrong decision, and kill the elderly person who is right, or would you go straight and kill all the six kids who are wrong?
Can we stop the train?
Unfortunately, that option doesn't exist, but right. This was one of the options or answers which was debated. They were saying that if the vehicle is going at a rapid pace, can we actually apply brakes? But again, they were saying that at 120 miles per hour, even if you apply brake, would you prevent that accident from happening? Not really. Right. So, given this, what's happening is some kind of explainability is being built in. For example, if it's a facial recognition application, if I build an AI application to recognize faces of the people,
And before that, what's the answer for your question?
there is no right or wrong, Dr. Ilan, for that. So there is no right or wrong, and it's there. I mean, now there are a lot of legal bodies which are being formed. They are thinking out a lot on how do we address this, but there is no right or wrong. And what's happening is, with respect to healthcare AI, they are bringing up explainability. Like this facial recognition system that I've told. If there is a facial recognition system which is identifying that you're a human, but it's looking at your hand predominantly and saying that you are a human, versus there is another application which is recognizing your face and saying that you are a human. People will rewrite this application which is recognizing face and then classifying that that's a human, right? On similar lines, when it comes to AI, if it's cancer prediction using radiology or pathology images, is it highlighting the right portion or not? The AI. That kind of explainability is being built in, and doctors have to look at that, and the knowledge of both doctors and AI would actually help solve the problem. It's neither AI alone nor the physicians alone. It's a combination of both which is going to drive this AI.
So, what's the current legal standpoint of view in the autopilot of the cars if an accident happens? It's a company's fault or it's a driver's fault?
In this particular debate, people are saying that let us divide equally the fine across all the stakeholders, like the car manufacturers, the AI solution builders, and the driver. Right? Let's put equal penalty on all three, is what people are debating now as we speak.
And with my experience in the last 20 years, I have seen healthcare, it's a bit slow in adapting newer technologies. I think it's slightly bit slow. For example, Zoom has been widely used in many industries even before COVID. And we have started using Zoom or any other video consultation or online platform post-COVID. So we are ready to adapt newer technologies when there's a real need actually. I'm sure there will be some kind of reluctancy among some people in healthcare where they might think they might not need AI at this point of time. At the same time, we know that it's inevitable. Even without our knowledge, it's going to take up many roles what we are playing right now.
Yeah.
But as an AI expert or data science expert, how do you think we can train healthcare workers, or especially doctors, or whoever is working in healthcare? How can we make a change in their mindset, and how can we train them over the period of time?
So nowadays, what's happening is a lot of AI programs which exist are majorly focusing on math derivations, big equations, which will actually scare the people who are from non-math background, or they are teaching a lot of programming, which would scare away the non-programming professions. Doctors, healthcare professionals are coming from non-math and non-programming background. They're not IT professionals. So, not to scare them, I would recommend that you explain all the auto machine learning and auto AI techniques. Nowadays, you need not write even a single line of code. You need not worry about the math behind the scenes for the machine learning algorithms. All you need to do is just do a drag and a drop and then click on submit and your application is built. From that standpoint, if we can teach the healthcare professionals and also help them understand that the domain knowledge that they have, that's important. There might be a programming expert, or there might be a guy who's from math background. They will never be able to build a cancer prediction model or anything for that case in healthcare if they don't have domain knowledge. So since doctors and healthcare professionals already have the domain knowledge, training them not on the thorough math derivations, but at a high level on how to apply these techniques and how to solve the real world problems will help, intensify or fast track the adoption of AI.
Good. I think we should have a longer chat a bit later, I think.
Yeah.
Thank you, Bharani. Thank you very much.
Thank you.
Thank you.